Now I will show you one of the atypical cervical vertebra. Cervical 1 or atlas, cervical 2 or axis, and 7 cervical vertebra. This is atlas. Why the name is atlas? What is the meaning of it? It means it supports the globe of the head. This is the head. It supports the globe of the head. So the name of the bone is atlas. Then what are the anatomical parts or presenting parts of atlas? Mainly there are three parts. One is anterior arch, this is posterior arch, and two lateral mass. And this is a big foramen or big gap. Then what are the unique feature for first cervical vertebra? Unique feature means there are some features which are present and there are some features which are absent. So what are the important features which are present in the first cervical vertebra? Number one, the anterior arch and posterior arch, which are not present in case of the typical cervical vertebra. Then anterior tubercle on the anterior arch and posterior tubercle here on the posterior arch. Number three, the long axis of the lateral mass. This is the lateral mass. Its long axis, it converges anteriorly like this. And the transverse process, this is transverse process, are longer than those of the other cervical vertebra except the 7th cervical one. You see here the transverse process is shorter, this one. But in case of first cervical vertebra, the transverse process is longer. Then what are the features which are not present in this 7th cervical vertebra? Number one, it has no body like that of the other cervical vertebra. Number one. Number two, no spinous process. Here you will get the spine, but here there is no spinous process or spine. And also no costotransverse bar here. Here this is costotransverse bar for the other cervical vertebra or typical cervical vertebra, but here there is no costotransverse bar. Then how to differentiate the anterior arch from the posterior arch? Posterior arch is longer than the anterior arch. How much longer? The posterior arch, it forms about 3/5 of the circumference of the ring of C1 vertebra. This is 3/5. So the anterior arch will be 2/5. The anterior arch is presents a roughened anterior tubercle. This one, it is rough. But the posterior tubercle of the posterior arch here, it is rudimentary, very small. The posterior surface of the anterior arch, this is posterior surface of the anterior arch. You know, this is the anatomical position. So this is anterior surface, this is posterior surface. On the posterior surface of the anterior arch here, in the midline, can you see this one? It presents a concave median facet for the articulation with the dents of the axis. Suppose this is the anatomical position and this is the dents of the second cervical vertebra. So these dents, its anterior surface here, it will articulate with the facet on the posterior surface of the anterior arch in this way. The superior surface of the posterior arch, this is posterior arch, this is superior surface. Here presents a groove. This groove for the vertebral artery. Which part? The third part of vertebral artery. Because we know up to the first cervical vertebra, this vertebral artery second part extends. After that, this vertebral artery, it passes over this groove here. Then it ascends upward and enter into the foramen magnum of the occipital bone here. Now it becomes the third part. So the vertebral artery becomes third part after it exits from the foramen transversarium of first cervical vertebra. Where do you find the C1 or first cervical nerve? The first cervical nerve, it is passing deep to the third part of the vertebral artery. Then what are the articular facets on the lateral mass? This is lateral mass. On the lateral mass, you will get articular facet, two facets on the superior aspect and two facets on the inferior aspect. The facet on the superior aspect, this facet is kidney shaped and large and also concave. This facet, it articulates with the facet or corresponding facet of the occipital bone. This is occipital bone. Here is the condyle. This is the facet. This is convex, but this is concave. So this convexity fits with the concavity of the first cervical vertebra, forming atlanto-occipital joint. And on the inferior aspect here, this facet is almost circular and also flat and slightly concave, and it articulates with the second cervical vertebra below. This is second cervical vertebra. Its superior facet is this. So the superior facet of the second cervical vertebra articulate with the inferior facet of the first cervical vertebra in this way, forming here atlanto-axial joint. And already you know here the dens or the body of the second cervical vertebra, it articulates with the facet on the posterior surface of the anterior arch. So here we got three joints, two on both sides by the articular process and one with the dens with the anterior arch. Then what are the features on the medial surface of this articular pillar? On the medial surface you can see there are some foramen. Can you see the foramen? This is the foramen. On this side also you will get the foramen. All these foramen are vascular foramen, and here is the tubercle on each side. On the medial surface of this articular pillar you will get tubercle. The tubercle gives attachment to one ligament, and that ligament is the transverse ligament of atlas. So here is the transverse ligament here. So in front of transverse ligament you will get the dens of the axis. This is the dens. So here is the ligament from this tubercle to this tubercle. So this is the ligament. Dens of the axis, it lies in front of the transverse ligament of atlas. Then what is the average different distance between these two tubercles on the medial surface? It is about 16 millimeter. Then what are the special features on the transverse process? This is transverse process. I told you it is longer than any other transverse process of any cervical vertebra except the seventh cervical vertebra. This is seventh cervical vertebra. So it is longer except the seventh one. But if you compare with the other transverse process of other cervical vertebra, always it is longer than the other. Number one. Number two, there is no costotransverse bar here and no separate anterior and posterior tubercle. The tip of this transverse process, it represents the posterior tubercle. The lateral length of the transverse process is called its apex. This one is apex. This is the apex. But it presents the foramen transversarium like that of the other cervical vertebra, and it transmits the second part of the vertebral artery along with the vertebral vein and the sympathetic nerves. Vertebral foramen of atlas, this one, it is divided into two compartments by transverse ligament of atlas. I told you is the attachment of transverse ligament. So it divided two compartments, one anterior, one posterior. The main content of the anterior compartment is the dens or the odontoid process of second cervical vertebra. This one. And the posterior compartment, which is behind the transverse ligament, which is about 2/3 of the foramen, is occupied by about of the half space by the spinal cord and also its covering and some blood vessels. So anteriorly mainly odontoid process and the ligaments attached to it, and posteriorly the larger part, it contains the spinal cord, its coverings, that means the meninges and blood vessels. Next questions, what are the structures related to the anterior surface of the transverse process? The relation, number one is the anterior ramus of the first cervical nerve, internal jugular vein, then occipital artery and spinal axillary nerve. What are the nerves related to the atlas? I told you the first cervical nerve, it lies on the groove here, deep to the third part of the vertebral artery. Then it divides into two branches, anterior ramus and posterior ramus. The posterior ramus passes over the posterior arch here in this way, and then it supplies the muscles of the suboccipital triangle. The ventral ramus, which winds round the superior articular facet of the lateral mass and descends in front of this transverse process. So the anterior ramus is passes this way and passing in front of this transverse process, and posterior ramus this way, and here is the foramen transversarium. So here is the vertebral artery. So C1 nerve is passing medial to this and passing in front of this anterior arch. And what are the structures attached to the tubercle, on the anterior tubercle and posterior tubercle? In the anterior tubercle, the structure attached is the anterior longitudinal ligament, and the posterior tubercle is the attachment of the ligamentum nuchae. So the ligamentum nuchae extends from external occipital protuberance occipital bone, then through the spinous process of C1 to up to C7 cervical vertebra. What are the joints formed by the atlas? Number 1 is the atlanto-occipital joint. This is the anatomical position, anterior arch, posterior arch. So this is the atlanto-occipital joint. It is an ellipsoid type of synovial joint. Here is one joint and another joint is there between the articular process. So one median and two lateral. 3 joints between the atlas and axis, and all are synovial joint, but this joint is the pivot type of synovial joint or uniaxial joint, because rotation occurs here in this atlanto-axial joint. So in summary, what are the important attachments of first cervical vertebra? I told you already, just I am repeating once again. This is anterior tubercle, the attachment is anterior longitudinal ligament. Then upper border of the anterior arch. This is the upper border, this is the lower border. And the upper border, you will get the attachment of anterior atlanto-occipital membrane. Above the bone is the occipital bone, so atlanto-occipital membrane. And lower border, anterior atlanto-axial membrane, because axis is below second cervical vertebra. So atlanto-occipital, atlanto-axial from the upper and lower border of the anterior arch. And from the posterior arch, this is posterior tubercle. Here the main ligament attached is ligamentum nuchae, and the upper border of the posterior arch, the attachment is posterior atlanto-occipital membrane, and lower border posterior atlanto-axial ligament. And on the tubercle of the medial side of this articular pillar, here ligament is the transverse ligament of atlas. But the structures on the groove of the upper surface of the posterior arch, I told you this is the third part of vertebral artery and first cervical nerve. And very common question asked, what are the structures passing through foramen transversarium? The answer is very simple. Second part of vertebral artery, sympathetic nerve plexus around the artery, and vertebral vein. And the structures passing through the large vertebral canal, anteriorly the dens and its associated ligament, and posteriorly the spinal cord and its meninges like dura mater, actor mater and pia mater, then anterior and posterior spinal arteries. And now we know how to hold the bone in anatomical position. So this is the anatomical position of the first cervical vertebra or atlas. Thank you very much.